Welcome to Shri Ram Medical College. Today we will explore what is blood clotting. When a blood vessel is damaged, the clotting or coagulation process kicks in to stop the bleeding. Blood clots are formed when platelets, a kind of blood cell, and proteins in plasma, the liquid component of blood, come together to cover a lesion. After the wound has healed, your body will typically destroy the blood clot in its own. Clots can form on the inside of vessels without any external injury and often do not dissolve on their own. These are potentially life-threatening conditions that necessitate prompt medical attention. Veins and arteries, both of which are part of the circulatory system, are susceptible to developing clots. Although both capillaries and arteries are involved in delivering blood to various parts of the body, their roles are distinct. Veins, which are vessels with a low pressure, return oxygen-poor blood from the body's organs to the heart. When blood cannot flow freely back to the heart because of a clot, discomfort and swelling can set in when blood pools behind the clot. Clots can form in other large veins of the body, but deep vein thrombosis, DVT, most often occurs in the legs. It is possible for a blood clot to break away from its original vein, travel through the heart, and lodge in one of the lungs, blocking blood flow. A pulmonary embolism, which occurs in the lung tissue, is a potentially fatal condition. People who are at risk for acquiring one type of clot are not always at risk for developing the other, as the risk factors for venous clots are distinct from those for arterial clots. Unnatural clotting can be triggered by a variety of risk factors or events, and each factor may do so in a unique way. The speed with which your body responds to the molecules in your system telling it when, where, and how quickly to form a clot is partially determined by your genes. Obesity is a risk factor because it causes blood flow problems in the veins, and old age is a risk factor because it increases the body's natural tendency to clot. Your blood clotting time can be affected by a variety of factors, including some medications. The majority of cases of blood clots can be avoided. In some cases, you may be able to reduce your risk of developing a blood clot by taking steps to manage certain risk factors. Talk to your doctor if you think you could be at risk due to your genes or your lifestyle. Tell your doctor about any history you may have of blood clotting disorders in your family as well as any medications you are now taking. Your primary care physician may recommend that you see a hematologist for treatment of a venous clot. Hematologists are medical doctors who specialize in diagnosing and managing blood disorders. A cardiologist, a neurologist, and even a hematologist may all be involved in the care of a patient who has been diagnosed with arterial disease and is at risk for developing an arterial clot. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website ShriRamCollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck. Goodbye.